And a very good afternoon to all of you. It's Monday, the 8th of March. It's the day when school children were allowed to go back to school. It's the day we are celebrating International Women's Day. My name is Ram Kelly, and this is the Community Hour. Joining me online is Richard Russell. He's a consultant physician. He's also the senior clinical researcher, respiratory medicine professional. Now, join me is, like I said, Richard Russell. And thank you so much for taking time to talking to us on Unity 101.
That's a huge pleasure, and thank you very much for having me this afternoon.
No problem. Ahead of the National No Smoking Day on Wednesday, the 10th of March, over the years, with the government restrictions on smoking, we've seen 6,600 deaths attributed to smoking. However, this is decreased of 3% in 2018 and 9% on 2009, which are considerable percentages. So let me begin by asking you, almost like many questions in one question. Why do people smoke? What do you gain from it? In your opinion, what age do they usually start smoking? And finally, what motivates them?
I think those are really good questions and actually critical, and actually only the person who's smoking can answer them for themselves. And it's actually really important to ask people this. I know what this is like, and I remember what it was like as a young man, a young boy, really, thinking about smoking. And we usually start smoking early. We may have the first cigarettes 14, 15, 16, because of the peer pressure, and we start to smoke in that way. And it often is that story. There's also an interesting piece of research which shows that young ladies, young women particularly, smoke in their teens because, first of all, it's actually they think it's cool, but also because actually they believe that it will keep them slim and stop them eating. So there's all kinds of peer pressures that occur early on. And then what happens is, and this is the trap that all smokers end up in, and I've counted myself in that in the past, you end up being addicted to the nicotine and getting the harmful effects of the tobacco at the same time as the nicotine, which you're then addicted to. So if you ask people why they smoke, well, often they'll say, because I can't stop, and because if I try and stop, I can't do it. And I don't, they are addicted to the actual nicotine as a drug.
I guess let's just go back to peer pressure. Would peer pressure in the past be newspapers and print media and maybe radio, where with the government restriction that you're not allowed to smoke indoors, the smoking on television and other media is now reduced considerably, and therefore the pressure isn't there. So having said that, what would be the other reasons other than this small amount of peer pressure that causes people to take up the vow? And would it be the responsibility of maybe the parents, the teachers, the lecturers and other senior people who should maybe guide them in the right direction?
Yeah, I think you're absolutely right. And actually, there still is a degree of peer pressure. There is still a degree of exposure to cigarettes being cool, particularly amongst young people. And also teenagers, young people have an opportunity to express themselves, to actually be slightly risk takers, to do things which are a little bit different to society, to what society would consider as normal. And smoking is part of that. So it's kind of part of the kind of growing up culture to a degree. But there's still pressure. But you're absolutely right to say that through legislation, which has come often from Australia to start with, interestingly, to this country, but banning of advertising and things have got better. When I was a kid, you'll remember as well, perhaps, Ram, that actually, tobacco advertising was everywhere, on every sports ground, on every cricket team, on every Formula One team, and all these things you saw as really cool actually was associated with tobacco. And tobacco companies are smart. They do not waste money, and advertising works.
Yeah. Would it be an element of rebelliousness as well when you're young, that you want to do something which maybe upsets your parents?
Yeah, I'm sure you're absolutely right. I'm sure that's part of it a little bit, and also the cool in crowd thing a little bit. And then, as I mentioned, with young ladies, there's been certainly young women. There's been certainly some research which shows that they are concerned about weight and feel that smoking will help keep their weights down. But before they know it, they're unfortunately addicted.
Yeah, I guess you're right there. And I guess really, people are more informed nowadays about the risks of smoking and the elements and the chemicals in it. And I guess that's really must help in the long term.
Again, I think you're right. People are informed. People do know that it's harmful. And interestingly, you've just said about deaths. Yes, it's wonderful to see that compared with certainly 2009, the death rate has come down significantly. Still far too slow, but come down significantly. But when we're young, and this is my problem, when we're young, we don't appreciate what life may be like when we're older. So actually, do you know what? Smoking when you're 20 to 25, is it going to make you breathless? Is it going to affect your health? But directly then, only a little bit. But actually, by the time you're 50 or 60, it is clearly affecting you. But if you ask a 25-year-old, oh, have you got any idea what you're going to be like when you're 50? They really will not know. And so it's as a doctor, I've got to look at the whole of life, and having that vision and that horizon, which I'm looking for my patients and all my young patients as well as young people who smoke, is so important.
I guess really, I'm just sort of whittling down into this, into the depth of this conversation, because when a parent says to a young person or a young man, you shouldn't do this because it'll affect you when you're 50, they just throw it out the window. But if a doctor like yourself or a GP was to say that, they'll take it more seriously. Would that be right?
Sometimes I think I actually, my attitude to my patients who are adolescents, so shall we say, between the ages of maybe 16 and 20, perhaps that's a bit extreme, but is actually to treat them like adults, to actually allow them to actually make their own decisions. As you mentioned, people are informed, and so my job is to inform and to give people the facts, not what they read on the internet, not what they see as hearsay, not what their mates told them, and not always what their parents told them, but give them the facts and say, do you know what? This is what you're doing. This is what it costs. This is what may happen. Make your own. I can't make your mind up for you. You've got to make your mind up yourselves. And if you do that, do you know what? They respond really in a positive way.
Okay. It's more of a conversation rather than directing do that. All right, let's break it down further. So, does smoke help people to release stress and anxiety? And could that be used as an excuse?
It is used as an excuse, and it's not true, because it usually is the case that actually the stress and the anxiety comes from avoiding smoking. So if you don't smoke, your nicotine levels drop, you get a stress anxiety response, you need to smoke again to do that. But of course, smoking is a distraction. So if you have stresses and anxieties, then smoking gives you something else to focus on and concentrate on. But there is little to no evidence that smoking releases stress and anxiety, and indeed quite the opposite, because it's a vicious little cycle you get into of nicotine addiction.
I guess the counter-argument for that would be, well, I deserve to go on holidays. Yes, I'll borrow the money on my credit card. I'll go on holidays, although you're not allowed to go now. And so therefore that becomes a reason for it. So I guess this is another way of people saying, well, it does relax me and anxiety smoking in it. But clearly, as you said rightly, as a professional, there's no evidence to the effect that it does.
No, and I think you're absolutely right, Ram. What happens is I think it becomes a habit. It's like the old habit as you used to have of having a cigarette after a meal or with a drink. And actually, do you know what? It's just a habit, and it's just a cultural thing. It has not got any real other meaning than that.
So why? I suppose really it's the culture thing, isn't it? Years and years ago, like you said quite rightly, the cigarette companies were burning it left, right and centre and getting every penny's worth of advertising to generate revenue for them, and people got used to it, and the young people will see their parents smoking, their peers smoking, and just continue, and maybe it'll take another generation before it's all fizzled out. Yeah,
and actually I think for years and years, the tobacco companies, and if you want to, it's very easy to look at the data on how this was done, were actually lying to governments about the damage and denying to the government what the damage was actually being caused by tobacco. And this is my scientific kind of fact, if tobacco was discovered today and was put through then the testing that we would have to do on a pharmaceutical, for example, to check that it was safe and had some effects on the body that were positive, tobacco would never, ever get to market. But you may be aware, but tobacco was badged as a food product in America to stop it after undergoing tests, because it would clearly be found to be toxic and dangerous.
Wow. Okay, so could you explain what secondhand smoking, or sometimes called passive smoking, is and the risk of it?
Yeah, that's a very important thing. As you'll remember, a few years ago, the Parliament very smartly passed a law banning smoking in cars when children are present, and part of that's because of the effects of secondhand smoke. So it's an interesting thing to think about. It's very obvious, really. If you're in a space where you breathe and you're smoking, you breathe out, much of the harmful vapor, much of the harmful smoke is going to come out of you as well as what goes into you, and that there are other people can actually be exposed to that. This was also really clear, and I've had several patients now who come to me in their middle age, 50s, 60s, and they've got emphysema, they've got smoking lung damage. And they say to me, but I've never smoked. And then I ask them, what jobs did you do? And you often see they're ladies, often women, and they've often worked in bars or in the entertainment industry, or some of them, interestingly, were things like telephonists inside switchboard exchanges, switchboards. And these people were exposed to passive secondhand smoke from somebody else smoking in their vicinity, which then, because of bad luck, because of bad genes, because of susceptibility to getting the disease, they then get disease. So it's so important and actually so wrong that someone could harm a fellow human being in this way.
I guess really nowadays it'd be the responsibility of the employer to make sure that they allocate cigarette breaks and they're away from their workmates and they adhere to the legislation as well.
Absolutely.
And I suppose really the next question would be, how long do they need to be exposed to secondhand smoking before the effect of that will be devastating in the years to come?
That's a very difficult question to answer, and honestly I can't give you an accurate scientific answer to that because everyone's different, and what you have to do is think about the degree of exposure, the degree of the concentration of exposure, and the time, how long you're exposed to, but also you have to put into the balance your own particular risk factors. So although there is no one particular gene which leads to cigarette smoke induced damage of the lungs, there are several genes which do affect that, and so if you've got some of those genes just by chance and just by accident, and you don't need to expose to quite the same amount of smoke to get the problem. So it's a very individual thing.
Okay.
The best answer would be none at all.
None at all, exactly. I always say if in doubt, just don't do it. Joining me online in the community hour is Richard Russell. He's a consultant physician. He's a senior clinical research respiratory medicine. What does that mean? Do you specialize in everything to do with your lungs and breathing, or is it a whole raft of things that you do?
So I have various hats that I wear, and one of my hats is as a physician. So I'm a physician means I'm an internal medicine doctor. I work at Leamington New Forest Hospital and at Oxford University, and I look after everyone that comes in with whatever medical problems they have, whether it's hearts, lungs, abdomens, infections, you name it, we look after it. But my area of speciality is respiratory medicine, and my area of main interest, research and clinically, is COPD, so lung disease caused by cigarette smoke in the main, and also asthma. So I look after the airways of people. So that's where I'm really into breathing. I'm really into clean air. I'm really into that kind of thing.
I guess that's so the association with COVID-19 is quite close to that. So you'll be researching on that area as well, won't you?
Yeah, we've just finished at Oxford. He's obviously very famous for what it's been doing with COVID research, and myself and a co-worker and a team actually in our department have just finished an interesting study on COVID, which we're publishing very soon, which is very exciting for people. So yeah, we're all looking into that, and it's been our clinical and research lives, as you can imagine, around for the last year.
Brilliant, and well done to you. What are the mental health and general health benefits of quitting smoking?
Well, let's break it down a little bit. And there are clearly benefits to stopping which occur over time, okay? And if you want to look at, for example, risk of cancer, whether it's lung cancer, esophageal cancer, or stomach cancer, that reduces over several years. Until about 10 years down the line, that reduces the risk of developing cancer because of the smoking you've done is back to that of the normal population. But interestingly, other things happen quicker. So if you want to break it down to things that happen very quickly, you develop a better sense of smell, better sense of taste. What women often notice is that skin wrinkles, particularly around their mouths, get better over the first 6 to 8 weeks. So that's a really wonderful wonderful immediate sign that actually you're getting better. Your skin color improves and your hands get warmer and not quite as cold. And things like cough improves and production of sputum reduces. So you to reduce those obvious respiratory symptoms. And then over the next few months, as the chemicals are cleared from the system, you have less susceptibility to developing chest infections and problems that occurs because of smoking, and your own cells in your own body start to work better again. Over then time, the risk of heart disease reduces, up to then including the risk of cancer reducing over the next years, over 5 to 10 years. So the benefits take time overall, but they're instant benefits to health to begin with.
Why is it that these benefits not widely advertised and promoted so people can see the good it will do to the individual?
That's a brilliant question. And I think we often, you're absolutely right. We often focus... If you think about, we often focus on the negative. You're absolutely right. When we think about, we try and, the advertising you sometimes see from to stop people, get people to quit smoking, is often to scare people a little bit and things. And actually, do you know what? We should be saying, you're absolutely right. We should be saying, do you know what? If you do this, you will look better, feel better, taste better, and you've got less cancer risk, and you've got less heart risk, and not only that, you've got more money in your pocket.
And I guess really we do spend an awful lot of money on outside cosmetics, and we don't look at our inner selves where maybe the root of the problems are. And if we have to address those problems, and like quitting smoking, it will actually go towards making you feel better, smell and enjoy life in the full.
I totally agree. And not only that, the financial thing's not small either. I had a lovely patient who came, I remember very clearly, he came into hospital, he had a really serious lung infection, and he was a big smoker, 60-a-day smoker, and he knew he was going to be in hospital for a couple of weeks having antibiotics, very strong antibiotics, and so he said he knew he'd have to stop smoking, and so I said, well, let's do it, why don't you do it? And he then put the money that he was spending on smoking into a pot in his room, and he was really into buying gadgets. And so within a week, he was able to buy himself a brand new mobile phone. Within 2 weeks, he was buying himself a new headset and stuff. And he was just so chuffed that actually he wasn't burning that money and wasting it. So you've got to think about those things as well.
And I was, when I was preparing these questions for you yesterday, and I asked my colleague, I said, what is the cost of a packet of cigarettes? He said it's about £12. Is that right?
Yeah. Yeah, absolutely. It's between, I think the cheapest you can get is probably about £9, and the most expensive is probably nearly £14. So it's a crazy amount of money.
All right. So there are myths that stop smoking treatments really don't work. And could you explain why people might think that?
I'm not sure why they might think that. Other than the fact, I think it's fair to say that the things we use to stop smoking are not 100% successful. And it's fair to say, if I nag you about stopping smoking, you've got about a 3 to 5% chance of doing it. So 95% of people, 95 out of 100, will not do it. But if I nag, 5 people, 5 will stop. So that is not very successful, is it? If we add in then nicotine replacement, if we add in some counselling, if we go up to our other drugs that we use to actually help people stop smoking, what is really encouraging, Ram, and I do really mean this, and the message to get out to people is over 50% will stop. So there is, in the past, I think it's true to say, our drugs and stuff haven't been great, but right now, our quit rates, with all of the help we can give through things like the Quit Hampshire service and things, so the Quit for Life Hampshire, is really successful, up to 50%.
And do you feel during the lockdown since March last year, the element of people being home all the time, maybe, obviously we don't have the stats to that, maybe have increased smoking if there had been a smoker in the past?
Well, I don't know. You're absolutely right. I worry about that. I can only speak of the experiences I've had with my patients, and some have certainly increased their smoking because of stress and anxiety and worry, and it's something they then reach to because it's something they can control. On the other hand, the data on COVID risk and smoking is very clear. You are more likely to get COVID. You are more likely to be seriously affected by COVID if you smoke, and so many people actually have quit. So there's been a really great campaign out there called #QuitForCovid, which has been run through Hampshire, and that's really been successful. And in one day, several thousand people contacted the Smokefree Hampshire service to get help.
Yeah, brilliant, absolutely brilliant. Now, nicotine has many, many products, and it's a company that wants to do R&D and develop and also make money. Would you say is addictive?
Nicotine is it's probably second most addictive substance known to man after heroin. And I do mean that. Nicotine is extremely addictive and is a real problem. And actually, it's very subtle, but it's very, very strong and potent indeed.
And does it cause cancer? I hear sometimes.
No, absolutely not. It's very clear about that. Nicotine is a drug, which is a chemical which is active in the brain. Okay, and it causes the brains actually to be switched on, and when actually you become without it, you get a down for not having nicotine around. So you end up needing the nicotine to keep things going. So it ends up in a vicious cycle of negativity. Nicotine doesn't cause cancer. Unfortunately, it's all of the other things in the cigarette that causes the cancer, all the tars and the phenols and the other nasty chemicals which come along with the nicotine from the actual tobacco plants itself.
Okay. I often hear somebody, I'm putting on weight because I've stopped smoking. Is that right?
Well, again, there is some evidence on this, and I think be very clear about this. What happens when you stop smoking? Well, actually, you're losing a pleasure thing in your brain. You're losing this neurotransmitter. You're losing the signal you need to actually provide some pleasure. You're also losing the habit that you had, the things you did with your hands, the kind of the whole paraphernalia of smoking, the lighting up, all of that kind of stuff. So actually, like I've said, that's a distraction. So actually, people then often do reach for other things, and one of the big things which gives us brain pleasure, and also is something to do, is eating. And so actually we do then reach for, some people will reach for foods as a substitute for the smoking. The evidence, though, and let's be very clear, the evidence is that if you stop smoking, you'll put on about 2 pounds. So it's not a large amount of weight. It's yes, it is there, and I'm not going to deny it, but it's only a small amount, only a kilogram or so, 2 pounds.
I guess really you're replacing that ritual that you've just described with another replacement, and that could be food, and it could be a replacement to what you used to do.
Yeah, you're absolutely right. And there's, I'm thinking to myself here, what is there anything nicer than a chocolate digestive? If you're feeling a bit stressed out and you want to just distract yourself for a minute, I get it, and I fully understand that. So you do have to counsel people and actually have to say, look, just be careful, be strict with yourself, and if you're going to snack, snack on something which is healthy and low calorie, low sugar, low carb, all that kind of stuff.
Brilliant. So patches is another form of cutting down smoking or stopping smoking as an aid. Does it help?
Yeah, really very important. So basically, if you were to ask me, can people stop on their own? The answer is yes. Okay, but it's really hard. And if you're going to stop on your own, you've got about a 3% chance of being successful. As I mentioned before, if I nag you as your doctor, it's about a 5% chance. That nagging adds another couple of percent. So it's a good thing for me to do. But on the other hand, just remember, the smoking is nicotine addiction. I think that's really important to say. And therefore, to replace the nicotine is so important. You've got to take away the harmful nicotine, which is what's in tobacco and in cigarettes, and replace it with something which is safe. And that's what we do find in nicotine patches. It's not quite the same, and people say it doesn't give me the same effect, but it's really important to use nicotine, what we call nicotine replacement therapy, NRT. And that could be patches, it could be an inhalator, it could be gum, it could be lozenges. There's all sorts of different ways of getting nicotine into the body.
I guess really, whilst I applaud yourself as a professional medical person and the GPs, nagging the individuals to start smoking, but you don't have enough time, do you?
Do you know what? That again is a fantastic point to make, and I just want to be very clear. So all my health professional colleagues out there, one of my roles is on the respiratory lead for South East England, and we've been running a campaign, as I said, the Quit for COVID campaign, right the way through the last couple of months. I'm getting information out to GPs, out to nurses, how to do it, because people are afraid, and people think, just as you said, Ram, that actually we're going to be nagging. Do you know what? But you can do it positively, and actually, just to say to people, if a medical professional is spending time with you on this, take it seriously. And it's the most effective thing we can do as medical professionals is get someone to stop smoking, because it stops the cancer, the heart disease, all of those other problems that are coming 10, 20, 30 years down the line. So it's so important for us to do it.
It's a long-term thinking rather than a short-term. Okay, so if someone smokes when they drink, would they have to give up alcohol?
That's a great question, because actually, no. As you're probably already aware, the government years ago now banned smoking and drinking in smoking inside in public places, and so actually it's difficult to do now. And I think really we've come as a society along on a journey where we've broken this link. You mentioned this link. You mentioned the link before, a little bit of habit, and when I mentioned culture. We've broken this culture now that smoking with drinking is cool. Do you know what? It's not. And if you want to smoke, absolutely do it outside, somewhere safe, in a place, in an environment, but don't bring it inside. And actually, it's actually really nice now to go to a pub for a meal or for a drink, and actually not then to smell of smoke afterwards. And I think everyone appreciates that, even smokers. So no, you don't have to change anything else about your life, but just actually break that link between smoking and other things you do which are pleasurable, like drinking or eating, etc.
Well, I do remember going to nightclubs and coming out smelling everywhere, and I didn't really mind at that time, but now thinking about it, it was horrible.
Well, I could tell you some stories of my medical school. Even in the bars in the medical school, it would be an awful thing, and your clothes you'd pick up the next morning, and they would be disgusting.
If somebody was successful at stop smoking, and then maybe 2 years, 3 years, or whatever the years down the line, your mate says, "Oh yeah, just one," and persuade you, and the urge is there to want to just pick up one cigarette. What is the likelihood of that person then having one, and then that starts to grow in form of a habit?
Yeah. That's another good question, and actually a real situation. Do you know what? This is a real question people ask me. It's actually, you've got to, I think, in your mind, say, I am now not a smoker. I don't do it. And I think that's really clear. You can always be someone who has got the potential for being addicted to smoking, but if you in your mind split yourself from being a smoker from being a smoker into a non-smoker, you can resist that situation. If you're going to have one, are you likely then to have more? Well, you possibly do, because one has got to start. You've got to start somewhere. 1, 2, 3, 4, 5. You're not going to get addicted with one. And I think that's fair to say. But one does lead to more. So you've got to have in your mindset, I am now a non-smoker. And trust me, Ram, there's nothing more challenging sometimes for people than someone who used to smoke a lot who now doesn't, and is really potent and really very strong about their feelings towards that.
Okay, how did you stop then?
When I was young, as a young person, I actually just did stop. I just decided, I said, do you know what? This is ridiculous, waste of money, waste of time. What is the point? What do I get out of it? Is it going anywhere? No, stop it. And I think that's really important. Do I still think? Do you know what I mean? What do I still think? Oh, I could really fancy a cigarette. Yes. Do you know what? Occasionally, and that's because I think I still get bombarded with imagery and that association in my brain of cigarette smoke and those things that culturally I learn. But that's all it is. It's you've got to have in your mind, I am now not a non-smoker. I'm not going to do it anymore.
Oh, it's easier said than for some people, isn't it? Yeah, okay. Would you advise that cutting down slowly will lead to people stop smoking?
Yeah, absolutely. So please, it's really important to do things in an organised way, and to do things in a way where you're with a plan. Okay. So again, Smokefree Hampshire is a great service we have, which is absolutely free, whereby people can contact professionals, and they'll see you. They'll do one-to-ones. They'll do videos, telephone calls, etc. Support you. And what they'll teach you is, cutting down is really helpful. Why? Because you're reducing the nicotine in your brain, because you're actually reducing the brain need for nicotine. But you then got to work towards stopping. So you set a quit date. So yes, it's National No Smoking Day on the 10th, this Wednesday. Too soon. I'd never say just stop on Wednesday. Don't do that. But you might be able to set a date in 2 weeks' time, 3 weeks' time, whether if it's an anniversary or an item, you know, some kind of thing, beginning of May, for example, say, right, I'm going to stop on the 1st of May. And then I'm going to work backwards from that, cutting down, as well as supporting with nicotine replacement and our other medications that we use to actually work towards that date of when you say, right, that is my last cigarette. And I ask smokers, you know, when did you stop? And they'll often tell me exactly the day, the date, the time they had their last cigarette. And that's fantastic.
And do you find from previous stats that on the No Smoking National Day that there's an increase of people stop smoking?
Yeah, there is, and there's always a little hit of activity and stuff, and we want people to follow it through. And the other time we're really passionate about is obviously January and New Year, and people begin to reset what their plans are for the year and stuff. And you know what, Ram, you've already said this. Life has been so tough for everyone for the last year, not, you know, least of all us medics and nurses, particularly in hospitals. But life has been particularly tough, and we're looking forward now. Spring is coming. You know, we schools are, like you said at the beginning, schools are back, and actually, yeah, it'd be great to say, right, when lockdown is over, why don't I stop smoking and plan it around, you know, maybe the date in April when restaurants are opening again, and say, right, do you know what? I'm going to go and plan to go out for a meal. Well, now lockdown's over, and I'm going to do it without smoking.
I like your positive attitude when the restaurant's open. I like that. This is the Community Hour here with me, Ram Kelly on Unity 101 Community Radio on Monday, the 8th of March. Online with me is Richard Russell. He's a consultant physician as well as a senior clinical researcher in all sorts of things to do with your breathing within your body. And we've talked a whole lot of things. Let's just have a quick sort of quick fire question, if I may. Would it stop enlisting your friends to share in your journey to stop smoking?
Yes, absolutely, because it really helps. Because people will support each other, and you've got friends who are non-smokers, and if you ask your smoking friends, do they want to stop? They'll often want to do it, so do it together.
And what about, I know it's tough now to get an appointment because of COVID, to speak to your GP, and would the GPs give you an appointment?
Yeah, absolutely. This is critical. It's an important part of what we do. General practices sometimes run their own smoking cessation clinics, and nurses in general practice have got special skills, but also smokefreehampshire.co.uk or quitline 66777, send a text to that. That's all you need to do.
Getting help from cravings, what kind of helps are available? You mentioned earlier a few, but just reiterate those again, probably. Yeah,
really, really important. So actually, if you have cravings for cigarettes, it's because you're withdrawing from nicotine. So nicotine replacement is really important. And they come in various different types, patches as a background, plus gum, plus sprays, plus inhalators, and plus lozenges, all sort of things which work to replace that nicotine, as well as some other drugs we can do to reduce the cravings directly in the brain. And what about support network? Does that help you, knowing that people are there to support you and understand your... 100%, absolutely, because you need to know that other people are going through the same. It helps you, and you actually support each other. There's nothing like that kind of peer support. Just like we start smoking because of peer pressure, peer support to get people to stop is absolutely wonderful. So then you can go out and do exercise with each other and do other things maybe that are healthy, that actually are great for you from a lifestyle as a non-smoker. And do you feel that staying healthy while you're quitting aids a successful outcome? That's a really good point, in that being healthy is obviously important. I'm not going to say no, but actually, if you think about smoking and you want to change part of your lifestyle as part of that, and smoking being a negative part of your lifestyle, do you know what? Well, then go for it. So if you're going to stop smoking, well, actually, I'm going to say, right, I'm going to stop smoking, and I'm going to cut down on unhealthy foods. I'm going to lose a bit of weight, and I'm going to start exercising again. Now, you could argue that's too much altogether, but do you know what? If it's part of the change in healthy lifestyle that you want, particularly around COVID, you know that's good for us, then go for it. Indeed. Okay, as a doctor, what would you advise people to keep themselves focused on the goal they set out there to stop smoking? It's really important, as I mentioned earlier, to do this in a programmed and organized way. So you keep your focus. You don't hurry it. You don't do it too slowly. You set a date. You set a goal. You set a quit date, and you work towards that. And in keeping that date, you know that you can cut down the cigarettes until that date, replace them with nicotine replacement, and then stop smoking. And that's really important to work through it and keep your focus.
Brilliant. Okay, let's talk about electronic cigarettes or vaping, which has become quite popular in the last decade or so. How safe are they?
Oh, that's a Ram, that's a controversial topic, and you're going to get me into trouble here.
Okay, well let's not go there because I'll get in trouble as well.
No, I mean, no.
Well, let's say, let me change that question. Would you say it can be an aid to help you reducing to stop smoking?
That's a really good point. So our evidence is very clear about this. Electronic cigarettes or vaping, okay, is certainly, and listen to my words, less harmful than smoking cigarettes, okay, because there are less harmful drugs in vaping than there are in cigarettes. However, there is accumulating and increasing evidence that vaping itself is harmful, and indeed you are putting a bunch of chemicals that you don't need in an uncontrolled manner into your lungs. And so there's all kinds of chemicals in the vaping, in the flavors, in the colorants, and actually in the glycerol, which is a lot of the fake smoke that you see itself. And that will cause trouble in the lungs. So can they help stop smoking? Yes, they can. And we feel very strongly in Britain, and United England anyway, particularly, that vaping as a replacement for cigarettes, e-cigarettes, is important and can be helpful, again, working towards quitting. So I would say, right, I'm going to set a quit date 1st of May, I'm going to switch to vaping, and then I'll wind the vaping down until the 1st of May, then quit it all, because you're still a nicotine addict, Ram.
Yeah. I guess it's you've said it repeatedly. It's more structured program way of actually reducing it as such.
And let me ask you a question. Can I ask you a question?
Sure.
Okay. Who do you think owns the vaping companies?
I'm not going to answer that. In fact, I don't want you to answer that question. No, it's scary because actually the vaping companies themselves are owned by the tobacco companies. Yeah, I know
that. They will lead. It's in their interest to keep people addicted to nicotine. It's their product.
Yeah, I understand that. You mentioned in our conversation since we started the word chemicals. Could I argue the fact that when you as a doctor prescribe tablets, we're also putting chemicals in our body, and therefore there are side effects of that as well, and maybe an addiction?
Sure, and again, do you know what? I don't draw much difference in that sense, except for the fact that we know and we have tested out the medications that we use, and our drugs. They are harmful if used in excess or if used in the wrong way or in the wrong people. But they are given after significant testing, both toxicological testing, so safety testing, as well as efficacy testing. None of this happens with any of these other products that we're putting in our bodies. So it's so important that yes, you're right. In principle, they're very similar, but actually in practice, the way they're given and the monitoring and the safety side of things is such a different kettle of fish. There also is an issue, I think, with the side effects, in that we know what the side effects are of our medications, and we keep an eye out for them, and we control the dosings and things, which we don't do with tobacco.
Because it's voluntary and you take as much or as little as you want to. One thing that we haven't mentioned, particularly with the South Asian community, is chewing tobacco. Is that worse than smoking, or is a similar adverse effect of smoking?
I'm a chest doctor, so I'm really interested in lungs, and so actually, for me, smoking is the biggest evil. It causes 85% of my patients have smoked, and so that just gives you a fact of how many people I see. So smoking is really bad. Chewing tobacco, has its own problems, and although it doesn't cause the problems in the lung, it does cause problems in the mouth, and there is evidence of still increased cancer in the mouth, particularly topically as well, which is a real worry if you do it over many, many years. Also esophageal cancer and stomach cancer. So actually you're kind of switching one harm for another in some ways. Unfortunately, tobacco is a substance which is complicated, full of over 1,000 different chemicals, which unfortunately are harmful to the body.
Okay. You know, when you have your patients who you've given guidance and gently nudged them in the most positive way, and they keep on coming back to you, how do you make sure that you don't lose your cool and then you still keep on driving that message because that's what you want for that patient and you want the best for that patient?
Well, I think that's really. Do you know what? You've nailed it in the end of that question. What you do is you work on relationships. You get to know your patients. You actually understand their problems. You want to understand why they smoke and why they continue to smoke, and then you offer them help, and in a trustworthy and as a kind of a therapeutic relationship friend. I never nag. I never tell. I always say, you know what? I also believe
you don't nag.
Yeah, no, I believe very strongly that it's morally bankrupt to actually just tell someone to stop smoking, but then not offer them help.
Right.
So you've got to refer people onto some advice and some support so they can actually get help, because just nagging is wrong.
You give advice with answers that people can go away, and then you monitor them. Let me just nearly at the end of the program, how do you as a doctor, we hear it on the national media that you guys are rushed off your feet, which you, I'm sure, and particularly with all the responsibility that you have, how do you create work-life balance?
Well, you have to ask my family that. I think that's really hard. I think being in a caring profession, and I really do mean that for everybody. I'm not doing this for saccharine coating. I believe is a vocation and is a choice, and is for some people can do it and some people can't. It's very difficult to switch off. Particularly in this last year, we've had some very difficult times. Everyone has been affected by COVID. Of course, we've all been affected by COVID, but in the health service, what we've seen sometimes has been really, really tough. And it's hard to switch off. And keeping that balance is about keeping things that allow your brain to switch off, whether it's watching some kind of trashy TV or whether it's playing a video game or any of those things that can actually just distract you from some of the other things. You have to have some downtime. It's so important because it can be tough, but it's also what I do, and I believe passionately in what I do, and I love what I do, Ram, and every single day is different, and I am lucky to do what I do.
Brilliant, absolutely brilliant. Okay, just summarize the advice to our listeners how to stop quitting. And now, imagine you talking to one patient now. So,
I would explain. It's really important to understand that smoking is you're getting nicotine to your body, and nicotine is an addictive substance. This substance is controlling you at this time, and we need to help people to actually overcome that control and reduce that addiction to nicotine, and therefore taking the tobacco away from that situation. The way to do it is with help and with support, with advice from your general practitioner, from specialist nurses, or from Smokefree Hampshire. And these people will provide face-to-face support, telephone support, and help you to quit if you want to do it on your own. You should never, ever, not never ever, but you should never try and just quit on your own, because you are likely not to succeed. Whereas we know that with support, you're very likely to succeed with nicotine replacement therapy to stop the cravings, with medication which can help you deal with the psychological sides of addiction to tobacco as well, and then getting you through that in a supported manner.
Brilliant. Richard Russell, a consultant physician and a senior clinical researcher in respiratory medicine here in Hampshire and in Oxford. Thank you very much indeed. The fact that I managed to get you on talking to you for 45 minutes, it's a miracle on its own.
It's been a huge pleasure, Ram, and thank you very much. And just to say, please go and see your GP if you want some help, or text QUIT to 66777, which is the Smokefree Hampshire helpline and the Smokefree Hampshire website. So please look for that, and we'll be there to help you.
Thank you very much indeed, and I wish you a very good afternoon.
And you. Thank you so much, Ram.